According to HPV Center, cervical cancer is responsible for the death of about 15,000 women in 2015. The fatality of this cancer in women has led to an increased advocacy for prevention through early detection when women avail themselves for screening. However, pap smear screening is expensive and only few laboratories in Nigeria can offer it. It is in a bid to explore other effective methods of cervical pre-cancer screening that Dr. Teresa Freeman Wang, the chair of Scientific Committee of the International Federation of Cervical Pathology and Colposcopy, fellow at Royal College of Obstetrics and Gynecology. She's a consultant gynecologist, Whittington Hospital and Portland Hospital for Women in London, and the visiting consultant gynecologist to National Hospital Abuja, Dr. Yinka Olaniyan, organized cervical cancer pre-screening training using virtual Lugos iodine and virtual acetic acid methods for medical doctors and nurses in Nigeria. The consultants say the method is about 90% accurate in detection of cervical cancer.
And the screening program that we're training nurses, midwives and doctors to do here is aimed at trying to reduce that burden for women, because the test is simple, and if we do see anything, the treatment is also for most women very simple, and we can prevent women getting cervical cancer. Visual inspection using dilute vinegar solution is, I agree, not the most effective method, but it is a very simple and easy method to train people, and it is significantly better than no method. We can reduce the burden of cervical cancer by at least 35 to 40% by this method.
The particular method we're using is visual screening. So we're training these women, these nurses and doctors, to be able to screen women using their eyes and some chemicals and then some cameras to capture the image. It's called visual screening methods. But this method is effective in good hands with good quality control. It's almost as good as pap smear.
Participants at the training outlined their achievements.
First is how to perform this screening. I mean the visual inspection using the acetic acid and Lugos iodine. Not only how to perform the procedure, but we have been taught how to even produce the reagents used for doing it, how to cancel the patient, and how to make it work. And also, I can bet you I can properly screen a woman. And with this training, I believe that most of my diagnosis will always be near perfect.
We want to prevent, because cervical cancer, we found out that it's a very patient cancer. Let me use the word. One can have a lesion and it will take 10 to 20 years before it becomes cancerous and the woman starts having symptoms. So it's a process where we open the woman up, we put this acetic acid or Lugos iodine, and we look to detect any changes. And the good thing is that many of the women would be normal.
Training for cervical pre-cancer screening for medical doctors and nurses using visual inspection method is said to be affordable and effective. But the big question is, how can this method be taught to more doctors and nurses, especially those in the rural communities, so as to save more lives? From the Nafowa Cancer Screening Center, Air Force Base Abuja, Joseph Kadri, ITV News.